Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Osteoarthritis. Introduction. Osteoarthritis is a common disease that affects millions of people around the world. It can cause pain, deformity, and disability.
Osteoarthritis, also called degenerative arthritis, results from wear and tear on the joints.
This program explains what osteoarthritis is and how it affects the joints. Diagnosis and available treatment options are also reviewed.
Anatomy. Our bones help us stand up straight, and our muscles help our bones move. Bones connect at the joints. The most obvious joints are the shoulders, elbows, wrists, hips, knees, and ankles. We have other joints between the bones of the fingers and toes. There are also joints that allow the vertebrae to move. A material called cartilage, which keeps bones from rubbing against each other during motion, covers the ends of the two bones in a joint. There is a small bag called the synovium that holds synovial fluid between the two pieces of cartilage. The combination of cartilage and synovial fluid allows for smooth, painless motion in joints. Arthritis. The word arthritis comes from Greek and means joint inflammation. Inflammation is a normal bodily reaction to injury or disease. Inflammation is usually temporary, but in the case of joint inflammation, it can have permanent effects. Arthritis happens when disease or damage causes a joint to become inflamed. There are more than 100 types of arthritis. Osteoarthritis is the most common type of arthritis. It can affect any joint in the body and develops from wear and tear on a joint. Another type of arthritis is called rheumatoid arthritis. Arthritis usually leads to pain and limited movement of the joint.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms and causes. Over time, as a joint moves, cartilage deteriorates and its smooth surface becomes rough. As cartilage wears down, bone rubs on bone, damaging the bones and causing pain. Sometimes new bone grows along the side of existing bones, creating bone spurs that are painful. When arthritis is very severe, both bones of the joint may grow into each other, causing the bones to fuse together. The joints most commonly affected by osteoarthritis include the joints between the fingers, the joints between the vertebrae, hips, knees, wrists. Osteoarthritis pain ranges from mild discomfort to unbearable pain. Pain, deformity, or both can cause disability. Osteoarthritis can cause the spine to curve abnormally, a condition known as scoliosis. The nerves or spinal cord may become pinched due to osteoarthritis as well.
Osteoarthritis not only causes pain but can cause swelling and stiffness of the joint. Bony lumps are common. They are mainly seen on the finger joints.
Pain, swelling, stiffness, and bony spurs can cause decreased flexibility in affected joints. Osteoarthritis pain may happen during or after the joint is used. It may also worsen during weather change. Osteoarthritis pain may disappear within a year of when it starts. However, it may return if the joint is overused. Risk factors. The following groups of people are at higher risks of developing osteoarthritis. People older than 45 years old. Females and obese people. People with family history of osteoarthritis. People with other types of arthritis, such as gout or rheumatoid arthritis. Diagnosis.
If you have swelling, stiffness, or pain in one of your joints that lasts longer than 2 weeks, you should see your healthcare provider. To diagnose osteoarthritis, your healthcare provider will perform a physical examination and a variety of diagnostic tests, such as blood tests. X-rays and various radiological scans are very useful to find out the condition of the joints. Your healthcare provider may order X-rays, bone scans, a CT scan, an MRI, or an arthrography. These radiologic images help your healthcare provider find bone spurs and worn-down cartilage. Sometimes your healthcare provider may recommend that fluid be taken from the joint and tested to confirm the diagnosis.
Treatment.
Unfortunately, there is no cure for osteoarthritis. Losing weight and staying in shape helps decrease some of the symptoms and tends to slow the arthritis in some joints. The disease can also be slowed down and controlled with various medications that decrease inflammation in the body. Some osteoarthritis medications are common over-the-counter anti-inflammatory medications such as ibuprofen or aspirin. Acetaminophen is another common medication for people with mild or moderate pain. An antidepressant may also help. Stronger medications may be needed. These include various types of steroid medications. Steroids can be very effective, but they have many potential side effects. Steroids should be taken as prescribed and should never be stopped without first discussing it with a healthcare provider. Steroids or other medications may be injected directly into the affected joints. In order to keep the affected joints in shape, physical and occupational therapy may also be used to treat osteoarthritis.
Splints are used to help prevent, slow down, or compensate for joint deformities. If all attempted treatment fails, surgery may be necessary to fuse, replace, or stop deformation in joints.
For example, an unstable wrist could make the wrist useless, but if surgically fused together, the hand could be useful again.
Hip and knee replacement are routine operations that may help alleviate the pain and increase the patient's mobility. Sometimes surgery is needed to take the pressure off the spinal cord or nerves in the spine.
Alternative treatments, such as acupuncture and nutritional supplements, may improve symptoms but are not proven to work. Acupuncture places very thin needles into specific areas of the body. It may help improve joint function and reduce pain. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Osteoarthritis is a fairly common disease. It can affect any joint in the body and develops from wear and tear on a joint. Osteoarthritis not only causes pain, but can cause swelling and stiffness of the joint. Bony lumps are common. They are mainly seen on the finger joints. If you have swelling, stiffness, or pain in one of your joints that lasts longer than 2 weeks, you should see your healthcare provider. Osteoarthritis can be slowed down and controlled with various medications that decrease inflammation in the body. Physical and occupational therapy may also be used to treat the condition. Losing weight and staying in shape helps decrease some of the symptoms and tends to slow the arthritis in some joints. Thank you for using Explain.